Ladies and gentlemen, when we think about vitamins, especially as we age, the tendency is to assume that more equals better. If a small dose of vitamin D is good for our bones, a higher dose must be even better. If vitamin A supports our vision, why not double up? But in the world of biology, particularly when it comes to fat-soluble vitamins, this mindset can backfire, sometimes dangerously so. Let's start with a quick understanding of what makes fat-soluble vitamins different. Unlike water, soluble vitamins such as vitamin C or most B vitamins, which are flushed out regularly through urine, fat-soluble vitamins, namely A, D, E, and K, are stored in the body's fat tissues and liver. This means they persist in the body for much longer. It also means that if you're taking these in high doses daily, often unknowingly through multivitamins or stacked supplements, they can accumulate to levels that push beyond helpful and into harmful territory. Consider vitamin A. It's crucial for vision, immune function, and even gene expression. But the issue lies in chronic overconsumption. Seniors in particular are vulnerable because they may be prescribed or choose supplements aimed at supporting eye health or immune resilience. However, most people, especially in developed countries, already get sufficient vitamin A through their diet, mainly from dairy, eggs, liver, and fortified foods. Adding more via supplements can result in a slow but steady overload. Clinical research has linked excessive vitamin A levels to decreased bone mineral density, which is already a concern for aging individuals. This creates a paradox. A supplement taken to promote vitality may actually increase the risk of fractures and skeletal weakness. Vitamin D is another prime example. It has received enormous attention in recent years for its role in immune function, bone health, and even mood regulation. And yes, vitamin D deficiency is real and needs correction. But there's a growing problem with indiscriminate supplementation. Many people take high-dose vitamin D daily without checking their serum levels. Why is this a problem? Because excessive vitamin D raises calcium levels in the blood, which can lead to vascular calcification, a risk factor for heart disease. In seniors whose arteries are already under strain from age and other factors, this can be a serious concern. Then there's vitamin E, once hailed as a potent antioxidant capable of fighting everything from aging to cancer. It was consumed en masse for years. However, large-scale clinical trials like the SELECT study have shown that high doses of vitamin E can actually increase the risk of certain diseases, including prostate cancer and hemorrhagic stroke. Again, the issue isn't that vitamin E is harmful. It plays essential roles in immune function and cell protection. But the unregulated, excessive intake distorts its benefits. This is where we need to shift our understanding from a quantity-based model to a precision-based one. The body doesn't operate on the logic of more is better. It operates on balance, homeostasis. The biological principle of internal stability depends not just on the presence of nutrients, but on the correct ratios between them. Take vitamin D and vitamin K2, for instance. They work synergistically. Vitamin D enhances calcium absorption, while vitamin K2 directs that calcium to the bones and away from arteries. Supplementing one without the other, especially in high amounts, can tip the balance in ways that strain rather than support the body's systems. Seniors are often more sensitive to these imbalances due to metabolic changes that come with aging. The liver and kidneys, the main organs that process and excrete fat-soluble vitamins, may not work as efficiently as they did decades earlier. This slows the clearance of excess vitamins, increasing the risk of accumulation and toxicity. And it's not just about toxicity in the clinical sense. Even subclinical excesses, levels not high enough to be diagnosed as poisoning, can subtly impair physiological functions over time. That might mean increased fatigue, unexplained joint pain, digestive issues, or cognitive fog, all of which can easily be misattributed to aging itself. The modern supplement industry tends to sell vitamins in mega doses because it's easier to market something that promises more energy, stronger bones, or sharper memory. But the research shows clearly, targeted, individualized supplementation guided by lab tests is safer and more effective than blind dosing. So what's the takeaway? Fat-soluble vitamins are powerful tools, but like all tools, they can harm as easily as they help when used without precision. Seniors especially should avoid assuming that a daily multivitamin or high-dose standalone supplements are always beneficial. The smartest approach is to consult with a healthcare provider, get regular blood work done, and treat supplementation as a form of medicine, not as an insurance policy. In neuroscience and in biology more broadly, systems thrive on equilibrium. Our brains, our bones, and our immune systems all need nutrients, but they need them in the right amounts and at the right times. With fat-soluble vitamins, less can often be more, and more can sometimes be too much. In the world of health and wellness, there's a deeply ingrained belief that if something is good in small amounts, it must be even better in larger doses. This is particularly common with vitamins. The logic seems sound on the surface. If vitamin D supports the immune system, more of it must supercharge immunity. If vitamin A is good for the eyes, doubling or tripling the intake might protect against vision loss. But biology doesn't work like that. The human body is not a machine that simply improves linearly with added input. It is a highly adaptive and tightly regulated system, designed to function within a narrow range of balance, what scientists call homeostasis. Fat-soluble vitamins A, D, E, and K pose a unique risk when it comes to this assumption. Unlike water, soluble vitamins, which are excreted easily when consumed in excess, fat-soluble vitamins are stored in the body's fat tissues and liver. This makes them useful in terms of long-term availability, but it also means they accumulate over time, especially when consumed in high doses regularly. That accumulation can push levels beyond what is healthy, often without any immediate symptoms, making toxicity or dysfunction a slow and silent process. Take vitamin A as an example. It's essential for eye health, immune function, and skin integrity. However, when consumed excessively, particularly in its performed version, such as retinol from supplements or animal liver, it becomes toxic to the body. The liver, which stores vitamin A, can become overwhelmed, leading to a condition called hypervitaminosis A. This condition is associated with symptoms like bone thinning, liver damage, nausea, and even blurred vision. Ironically, the very thing people often take vitamin A to protect. In older adults, the problem is compounded. Their bodies are less efficient at processing excess nutrients, and their bones are already at greater risk for thinning. Studies have shown that chronic high intake of vitamin A may actually increase the risk of fractures in older adults, especially postmenopausal women. Vitamin D, another fat-soluble vitamin, has gained immense popularity in recent years. It supports calcium absorption and plays a critical role in immune function and even mood regulation. There's no doubt that vitamin D deficiency is a real issue, especially for people living in low-sunlight environments. But many people, especially seniors, begin taking high-dose vitamin D supplements without knowing their baseline levels or the upper safe limits. When taken in excess, vitamin D can raise calcium levels in the blood to dangerous levels, a condition known as hypercalcemia. This can cause vascular and tissue calcification, potentially harming the heart, kidneys, and blood vessels. The very supplement intended to strengthen bones and boost immunity can, paradoxically, increase the risk of cardiovascular events when taken without appropriate guidance. Vitamin E, often included in antioxidant formulations, is another case where more is not necessarily better. It was once thought that high doses of vitamin E could prevent cancer and slow aging. However, large-scale studies, such as the SELECT trial, revealed an unsettling reality. High-dose vitamin E supplementation did not reduce cancer risk and actually increased the likelihood of certain cancers and hemorrhagic strokes. The brain, which is highly sensitive to oxidative balance, does not benefit from an overload of antioxidants. In fact, excessive antioxidant intake can interfere with the body's own ability to adapt and manage oxidative stress, undermining resilience at the cellular level. These examples point to a central truth in human biology. The effectiveness of a nutrient is context-dependent. More is not just unnecessary, it can be biologically disruptive. The body operates through tightly regulated feedback systems. When you overload a particular nutrient, you can suppress your body's natural production or uptake of others. For example, taking large doses of one fat-soluble vitamin can interfere with the absorption of another. High-dose vitamin D without sufficient vitamin K2, for instance, can lead to improper calcium distribution, putting calcium into soft tissues rather than into bones, where it belongs. This subtle imbalance can lead to long-term consequences like arterial calcification, something particularly dangerous in the aging population. What makes this issue more complex is that many seniors take multiple supplements daily, sometimes more than a dozen. Often these are self-prescribed or suggested through marketing, not guided by lab work or medical supervision. In many cases, there is overlap between supplements. A person might be taking a multivitamin, a bone health formula, and an eye health supplement, each of which contains fat-soluble vitamins. Without realizing it, they may be consuming 2 to 3 times the recommended upper limit of vitamins O or D every single day. The effects might not be immediate, but over months or years, this can quietly undermine health. The truth is, the best approach to vitamins is not excess, it's precision. Testing nutrient levels through blood work, understanding individual needs based on diet, lifestyle, age, and health status, and supplementing only to correct deficiencies or support specific, evidence-backed goals. This approach respects the intelligence of the body's internal systems, rather than overriding them with blind excess. It's not about fear of vitamins, it's about respect for balance. In the end, taking more of a good thing does not necessarily lead to better outcomes. With fat-soluble vitamins especially, the goal is not to flood the system, but to support it intelligently. The body thrives not when it is overwhelmed with inputs, but when it is given just what it needs. No more, no less.